Hi, good afternoon. All right, here we are again for insurance changes. Just to give a little background, the consortium, when we were looking at what to do about insurance again this year, our UHC first came back. We had a 12% cap. They came with 24%. And we were a little confused since it was a 12% cap. What they said was all the federal law changes were not part of that 12% cap. And so basically at that point, M3 started working with us and said, hey, you know, we need to take this out to bid. Now for many of us, if you're in the support staff, if you're with the administration, this will be our fourth change in my tenure, 8 years, so meeting every 2 years, which is probably getting to be pretty standard if you look into the private sector and other businesses. So my guess is that here in a couple of years, you'll probably be right back in here, you know, either talking about changes maybe to the policies that we have, or potentially bid out. That's just the way things are happening. Now I think this go around is much easier for everybody. One is because now as teachers, this is the second time that you've had to go through it. The first time being, I think, pretty challenging due to the fact that we've been so long with the trust and have to change. And also didn't go very well. Now what I can tell you is, the good news is we're the last district to go. Last time we were the first district to go, and remember it didn't go quite so well in that meeting, if you were here. All the meetings have gone very well. So when they present, I know they're going to do a great job covering everything. I also think the plan design actually has benefits to us. One being is with Navigate, we no longer have Navigate, we have to have a primary care doctor, it's an HMO, and it's a bigger group. And some of them, like Mayo Clinic in Minnesota being one of them that wanted covered, is in that group. And so there are definitely some advantages to it. I'd like to tell you, you know what, this is going to be the last time we're going to be set for a while, but it's not. You know, we know the federal laws are going to start kicking in, and eventually the penalties will kick in, and there will have to be design plan changes. We know that the Cadillac tax will hit us if we don't do a plan design change in the next 2 to 3 years. We know that. We know we have to offer an affordable plan eventually in order for our 30-hour and above employees hourly have a plan that we will have to be able to offer to them that still makes it affordable. And so there will be plan design changes coming out, I would think, in the next year and a half, 2 years. And so we know that. That's just the nature of it with healthcare laws and everything that'll kick in. So let me turn it over. Today we have M3, and I'm going to let you guys introduce yourselves because I already forgot your names on the way down here. M3 and Arise. So I'll let them introduce themselves.
Thanks, Joe. That is your name, right?
Yes.
Okay. All right. Well, welcome everybody. My name is Donna Hirschleb, and I represent M3. M3 is your insurance agent consultant. So as Joe had mentioned, yes, your renewal actually came in as a 25% increase. There was no way that the district was going to pass that on, and the district just couldn't afford that type of increase. So we did take it out to bid, and fortunately we kept the plan very, very stable, kept the rate stable. The increase ended up being a 0.3% increase. So you'll see that. You'll be happy with the plan design. Nita from Arise is here as well. She's going to go into more detail on that plan design. I'm going to talk a little bit about, the reason for the change, and really Joe pretty much hit on that. We'll talk about this in open enrollment, the medical insurance, the dental insurance. We will also have questions and answers at the end of the presentation. And Nita and I, we have a 5:30 meeting with the retirees, but we're going to be here in between. So if you have any type of questions that you want to talk to us one-on-one on with, then we will be available at the end of the meeting as well. So with that, reasons for changes. Of course, the Affordable Care Act, there are some changes to the plan. Nothing significant yet. As Joe mentioned, there will be changes coming forth. 2018, the Cadillac tax kicks in. We wanted to sustain the plan that you had and give you guys the same type of choices that you had in the past. And again, the entire intent in going to the bid was due to that renewal that you had. Okay, so open enrollment period, you have a packet of information, your medical, your dental, you also are offered voluntary vision and voluntary accident. Those are open enrollment for July 1st of 2014. There's also a critical illness, a voluntary critical illness plan. That would be for your heart conditions, your cancers, your critical care that you need. Now that is not open enrollment for July. However, if you do want to apply, you can apply. And if you were to apply, you can see Kathy. She has the enrollment forms. But there is evidence of insurability that you will need to complete. So that is answering a lot of medical questions if you do choose to join the critical care plan at this time. All right, carrier change. Moving from United Healthcare to a RISE Health Plan. And again, Anita's going to get into all the details on the plan. I just want a high level. Door County Memorial, St. Vincent, St. Mary's, Bellin, Holy Family, Aurora, Theta Care, Mayo of Rochester, Minnesota. Those are all in your network, and then some. What's not included is the affinity system down in Appleton, as well as the Mayo locations that are within the state of Wisconsin. And again, Anita will address those into much more detail. Your dental plan is also changing. You will be changing over to Delta Dental, a local company out of Stevens Point. And I will go through that plan with you after Anita addresses the medical plan. Very little changes. You will see there will be very little impact to you moving to that plan. Okay? That's pretty much what I wanted to start the meeting with, and now I'll turn it over to Anita. Thank you.
Okay, thank you. First of all, I wanted to welcome you as new customers of Arise Health Plan. We're very excited to have you as new customers. And I wanted to tell you a little bit about Arise. For those of you that don't know us, we started out in 1997 as a provider-owned HMO. And in 2005, we were purchased by WPS Health Insurance out of Madison, Wisconsin. We cover Northeast, North Central, and Southeast Wisconsin. We're located in De Pere, so all of your customer service, all of your claims will be processed out of our De Pere office. So pretty close by, local service for you. And we also like to tell you we're a proud partner of the Green Bay Packers. So you have two plan options. And as you were coming in, along with all the goodies we had for you, there was a packet that was printed off for you by Kathy. So I'd like to work with that. And if you turn to page 4, you will see we laid out the plan options for you side by side. And what I'd like to start with is giving you a good understanding of the difference between our HMO and our point of service. As Joe talked about, our HMO does not require you to choose a primary care physician. But the primary difference between an HMO and a point of service is this. On an HMO, you must utilize an in-network provider in order to have coverage. So any provider that is in our directory, or if you look them up on our website, if you go to visit one of them, you don't need a referral, you can just go to see them, whether it's a specialist or primary care. You will receive coverage for covered services. On a point of service, you have a safety net in that you are able to visit out-of-network providers and still have coverage. So that is the primary difference between those two plans. Any questions on that? Okay. So your plan choices are the 500 HMO or the 500 point of service. After you've satisfied your deductible and your coinsurance, you also have things called copays. Your medical copays, your primary care copay, $10 if it's not a routine visit. Your specialist copay is $25, same as what you're used to. Your emergency room copay is $150. Now, on your old plan, you would pay your copays, and you just kept paying. On this plan, we have put in a separate out-of-pocket maximum for copays, and that is $500 for a single and $1,000 for a family. You'll see that as the second one up here. So, after you've paid $500 in copays as a single or $1,000 as a family, copays no longer apply. Okay, so it's an additional safety net for you. Then on your prescription drugs, You'll notice those on your sheet, we have a 0, a 10, a 25, or a 50. What we've done is the generic category, we've put a subcategory in there called value drugs, and those particular value drugs, which we'll get into later, have a $0 copay. The other generics will have a 10, your brand name will have a 25, and your non-formulary brand a 50. So it's a little bit of an improvement there. We've also put an out-of-pocket maximum on your prescription drug copays. It's $6,350 for a single and $12,700 for a family. Those are out-of-pocket maximums that are required by healthcare reform, but they're a good benefit. So any questions on those out-of-pocket maximums? Okay. All right. I'd like to move to this blue folder. I'm going to have to move over here. I need something to set it on. And I'm going to start with the left-hand side of the packet. Now, I'm not going to read all this to you, but I just want you to know where you can find information. So you should see 2 grids that are specific to the HMO and the point of service. Those are just additional details. But behind that, there's a blue sheet, blue and orange sheet that says preventative services. These are services that are covered at 100%, no deductible, no co-insurance, no copay. So I just want to point those out to you. You can look at them. Those are your routine physicals, your colonoscopies, all sorts of different routine care that we do cover at 100%. Behind that is your Express Scripts. Express Scripts, you'll see a little E in the right-hand corner. That is our pharmacy benefit manager. They manage our drug copays for us. And on this sheet are the most commonly prescribed medications. Those in capital letters are your brand name. The lowercase letters are your generics. So just something for you to look through. If your drug is not on there, please don't panic. Again, it's the most commonly prescribed medications. You can also look them up online. We've given you the instructions on how to go to our website. And then you can look at our drug formulary online, which will have more of the medications listed. Then in your packet, you'll see another sheet that says Arise Value Drugs. These value drugs are your zero copay medications. And on the front, we've listed them by the type of condition they treat. And on the back, we've put them in alphabetical order for you. You can get these at any of your retail pharmacies, or if you should choose to use mail order, you can get them through mail order as well. The next 2 sheets in your packet, one says Arise Drug Pre-Authorization, and then the next one is probably the drug pre-authorization form. And what that is some medications do require prior authorization. But when you're changing carriers, that takes a little bit of, you have to go to your doctor, he has to fill out some forms, yada, yada, yada. So what we like to do is, we list the medications for you. If you look through the list and you find your medication on there, you fill out the form that you send in to us. We will then take your file, and for 3 months, July, August, September, we will allow those prescriptions to be filled, no questions asked. So it's just kind of a little way to help you make the change and also give you time to work with your physician to get the paperwork in necessary to prior auth the medication. And then the last form on that left-hand side is if you like mail order, you will need to change to our mail order service. But once you get your ID card from us, you can go into your physician, have them fill out the mail order form, or you can fill it out and just attach a copy of a prescription. You will need a new script from your doctor, but we can get you set up on a mail order as well. Any questions? Okay, so then I'm going to move to the right-hand side of your packet, and it starts off with a map of Wisconsin, or a partial map. And this shows you what counties our footprint or our network is in. If you turn it over, we give you the major providers within that county. So in Door County, you'll see Door County Memorial Hospital. And then also North Shore, Aurora, and Baycare are listed. So it just kind of gives you an idea of the major systems. But if you wanted to go out and look to see if your individual doc is on there, I do have a sheet that says, how do I find my doctor before I have my ID card? So we give you the step-by-step instructions as well as screenshots of how to go on our website and look up your doctor before you have your ID card. Then once you get your doctor, I have a sheet in here that says, how do I find my doctor online? This is just a little bit of a shortcut for you. The next sheet we have in there for you looks like the one up on the map, or up on the screen here, and it's a map of the United States. Outside the state of Wisconsin, even if you're on an HMO plan, we do have a travel network or a WRAP network called First Health. So for those of you that have college kids outside of the state of Wisconsin, maybe going to the University of Minnesota, University of Michigan, wherever, this is how they can still be in network and be on an HMO plan. They would access the providers at First Health. So behind that First Health map, or the map of the United States, I've also given you instructions on how you can go on First Health and look up a provider. Coincidentally, this is how you access Rochester Mail. So this is how we get to Rochester Mail for you, which is why it's not covered in Wisconsin, because you can't use this network in Wisconsin. It's strictly for outside the state of Wisconsin. So how about your kids then that go to Madison or Eau Claire or La Crosse, because you'll notice that's not covered by either map. What we're doing is, with a little bit of help from you, we will take the file for those kids that are outside of our network but not out of state, and we will always pay their claims as in-network. The last page of your packet, I believe, is an enrollment form, or it was printed for you separately, and you'll notice that on the back side there's a space to list your dependents that don't reside at your home, and that's how we will identify them and always pay their claims high or in-network. Now, when they come home, or if they come home from school for the summer and they're back in Door County or in Brown County or wherever you happen to live, they do need to visit in-network providers when they're home. But if they're at school in Madison or La Crosse or Eau Claire, we will pay their claims at in-network. Questions on that? Because that's kind of, go ahead.
If you choose HMO and you're on the road as a family and you need to visit an emergency room in Montana, for example.
Good question. The question is, what about emergency care if you're on the road or if you're out, even if you're in La Crosse or Madison for that matter? Emergency care is always covered at in-network, regardless. Question?
What about post hospitalization after the emergency room? They say you need to spend 5 days in the hospital.
Okay. So you have an emergency, you go to the emergency room, and then you need surgery, or you have to stay for observation or something like that. You do need to contact us as soon as possible during that emergency stay, or have the physician contact us. But that would be covered subject to your deductible and co-insurance then, instead of that emergency room copay.
Would that be the same with the other POS?
The POS, yes.
So that'd be the same either way.
Correct.
And would that be covered then? That's what you're saying, right?
Yes.
Is urgent care covered then, like emergency care, that no matter who it's in, urgent care is urgent care?
No,
Okay.
it is not.
Then would you restate what the difference is between an HMO and a POS?
Okay, difference between an HMO and a POS.
I mean, related to that.
To emergency care, there is no difference. Emergency care is one of those exceptions to the rule, if you will. It is always covered at in-network level of benefits. Okay. Did I see another hand somewhere? Oh, sorry.
I'm going to have 2 college students in the fall, one in Madison, one in Milwaukee. I don't know what their address is going to be yet.
Just put UW-Madison or UW-Milwaukee. Your Milwaukee student will be in-network. There's providers available. Your Madison student is the one we need to identify. Okay? Any other questions? Okay. Behind that, the rest of your information is things that you're going to need to know after you get your ID card, how to find your EOB online, how to change your address. You can order additional ID cards if one gets lost, just all the different things you can do on our website. So if you can hang on to those until you get your ID cards, which will be coming out to you the last week of June. So that's when you should be seeing those. You will get them prior to July 1st. But the absolute last form is an authorization form. And what that form is for is if you call me and you want to talk to me about your husband's claim or your college student's claim, I can't talk to you because of HIPAA privacy. So we need an authorization or a release on file. And what you do is in the first section, you list the name of your husband or your college-age student. You check the box that they want information released. You turn the form over, and in section 4, you write your name, and then you have your spouse or your college-age student sign the form. If you turn those enrollment forms in or send them to us at a later date, we can then also take the file so that we know we can talk to you about those claims. So you would need one for each person in your household that's 18 or older, or if you want your spouse to be able to call us and talk to us about your claims, you would need one filled out on your spouse and one on yourself. Okay? Questions on that? I know it can get a little confusing. If you could either download the form from our website or make copies of the ones that are in your packets. Questions? Yep.
The young adults that are not college students, does all that still apply for
Yes.
that 26 on down who might
Yeah.
be living in another area?
Your dependents are covered to age 26 if they don't happen to reside in the service area. Those rules do apply, just like we talked about for the college kids. More questions? Okay, we'll be here afterwards, so thank you.
Okay, dental benefits, not quite as exciting as the medical benefits. So with your dental plan, you will also be making a change from the United Healthcare dental plan to Delta Dental. As I had mentioned before, Delta Dental is a local company. They're located in Stevens Point, Wisconsin. So whenever you're talking to customer service, you will be talking to somebody locally. Excellent, excellent customer service. I can't say enough about Delta Dental. Also, there is guarantees on your services with Delta Dental. So you've got fillings guaranteed for 24 months, you've got sealants guaranteed for 24 months, and the providers cannot unbundle their fees. Okay, they will not be charging you more. They have to charge you the same regardless of which providers that you seek services from. Okay. All right. The network within Delta Dental, they have 3 different networks, or actually they have 2 different networks. They have the Premier Network, and then they have a PPO network, and then there's non-network providers as well. 90% of the Wisconsin dentists are within the Delta Dental Premier Network, and 40% are within the Delta Dental PPO network. It doesn't matter if you go to a Premier dentist, a PPO dentist, or maybe a provider that is not participating at this time with Delta Dental. You will still have the same level of benefits. Okay, so your benefits won't change. The only difference may be that non-Delta Dental provider does not have a contract with Delta Dental, so they can charge you more than what the provider that is contracted with PPO, with the Delta Dental. What that means then is you'll see your maximum benefit is $1,300. So it could have an impact, and maybe it doesn't have an impact on that maximum, but you're still going to have the same benefits. Okay? All right. Toll-free number here to call Delta Dental. You can look up the providers on their website at deltadentalwi.com. So, again, there are those discounts within, those providers being contracted with Delta Dental. You could save as much as 25%. Okay? But again, the benefits will be the same regardless of that dentist. Yes?
Now, when you move into an area like when you do this consortium, do you now reach out to all the dentists in our area once again and say, okay, so there is an attempt again to reconnect with those dentists that may not be part of it?
I'm not from Delta Dental, however, they welcome any provider to join, the dentist to join their network. And even if you have a dentist and you know that your dentist is not part of the Delta Dental network, you can approach them and ask them, let them know that my benefits have changed. And now the district has Delta dental coverage, and that provider would be more than welcome to join the Delta Dental network. Okay, great question. So your plan hasn't changed. I'm going to go back a little bit. I'm just going to talk a little bit about medical one because I just thought of something as I'm looking at your deductible here. With your medical plan, and this question wasn't asked, which I'm really surprised, your deductible and your out-of-pocket cost that you've already satisfied on your medical plan, we're getting a report from United Healthcare. All that information will be credited to Arise, and you'll get credit for any deductible and out-of-pocket costs that you've already satisfied. So that's good news, okay? And the reason that I thought about it is it's a little bit different on the dental plan. Your dental plan has an individual annual maximum of $1,300. That's your benefit. You have $1,300 to spend. However, with the dental plan, if you've already satisfied your $1,300 between January and June 30th, it will be credited. It will be credited towards your dental plan, but that's more of a negative on the dental side because that means that you've satisfied and you've exhausted all of your benefits. Okay? So both plans you're getting credit for what you've satisfied. However, with the medical, that's a positive, and with the dental, it could be a negative. Okay? So you have no deductible, so there's no deductible to carry over. And then all of your services, your diagnostic, your basic, as well as your major, are all covered at 100%. Okay? Until you've reached that $1,300 maximum. You also have an ortho service on your plan. That's a $2,000 lifetime max, 50% coverage. Ortho, the good news is, if you have children going through ortho right now, that orthodontist, that lifetime maximum will start over again in July. Okay? So you start that lifetime maximum over again in July for any of your children up to age 26 that are on this coverage. Okay? Any questions on that? Okay. Yeah. Dental plan is pretty simple plan. It's very similar to what you had today. Okay, it's just that some of the providers may change a little bit. So Anita and I are here to answer any questions right there.
Yeah, my husband just retired from the state, so I'm transitioning to our district insurance from the state insurance. How does the Delta dental plan that you offer us, how's it better than what the state had? Because we had crap coverage on dental with the state plan. And it was Delta dental, but...
Yeah, I'm not familiar with the state of Wisconsin's dental plan. You'd have to do a side-by-side comparison. I mean, this plan is pretty self-explanatory. No deductible, 100% coverage, up to $1,300. You're welcome. More questions? Yes.
There was just an update on questions as far as getting 2 cleanings a year within, so it's not every 6 months.
Correct.
How does that work if you also wanted to get a periodontal cleaning?
Periodontal has, you get 2 extra cleanings a year, so you just get the 2 extra. Your dentist does need to do some documentation of the periodontal diagnosis, but again, then you get a 2 extra, so it would be 4 per year.
All covered?
Yes.
I thought I read, we pay the bill first and then we send, is that different, or will they direct bill to?
For Delta Dental?
Yeah, for Delta Dental.
If the dentist is a contracted Delta Dental provider, then Delta Dental will handle all the claims. The dentist will send the claim into, and the dentist will get paid directly. If the dentist is not a participating provider in Delta Dental, then the payment will go to the employee to pay. There's no contract with those providers. under major. Yeah. Let's see, major. Yeah. Yeah, adjustments to bridges, yeah. Implants, I don't know why. I mean, that's awfully expensive. I think you're gonna, it's way beyond your $1,300.
You know what, we're gonna have to get back to you
Yeah.
on that. I wanna be sure before we give you an answer.
It should be covered under major, but it's gonna eat up all your 1,300, yeah.
How about gas?
How about what? Actually, you know what, if you go to your packet on page 5, under major services, it does say letter D is implants, so yes, they're covered. And what was the second question?
In case you have or you want to get it. What do you take for it?
For anesthetic.
You know what, normally what they'll do is, if you want an anesthetic that is beyond what they cover, they'll give you the allowance towards like what am I trying to say, the Novocaine. And if you wanted to go use the gas, then you would need to pay the difference between them. But I mean, if you're having wisdom teeth out or something like that, then yes. If you're having a filling and you just want to be knocked out, that's a different story. I agree with you, I want the gas.
Did I hear Mr. Studding correctly before? You said that, let's say hypothetically, you have a sore throat, you think it's strep, you go into urgent care, Shopko, Green Bay, blah, 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 that is not covered?
No, we were talking about out of the area, so yes, your urgent care in the area is definitely covered.
Okay.
And thank you for bringing that up, because Aurora has now said that in Sturgeon Bay, Manitowoc, and De Pere, they will charge their urgent care as if it was an office visit copay. So they're going to put it through to us where it'd be a $10 copay instead of a $25.
So is ministry.
Yeah, and so is ministry doing the same.
Okay.
But I think the question is that, but you have to make sure that is in coverage. There's probably some urgent care in the Green Bay that are not in the network. Or let's say Appleton. Let's say you're in Appleton and you went to Appleton's urgent care, it would not be covered if they're under the HMO.
Thank you for that clarification. That was important.
Let's say you're out of state and you think you have strep throat ramification. So would you go to emergency room or is it urgent care?
What I would do is check to make sure that there's not a first health provider in the area. So let's say you're in Florida at Disney. I know that there are first healthcare providers there, and with urgent care as well, and I would go there.
Is that for the HMO and POA or just the HMO?
Both.
Both.
Mhm.
So what exactly is the difference? I mean, I'm paying $100 more for the POA.
Okay.
Tell me my advantages to spending $1,200 a year.
Your advantage is if you wanted a referral to a provider that's not in network. So you wanted to go to Mayo in La Crosse, and we say we're not going to approve that referral. On the HMO, if you went, there would be no coverage for that doctor's visit or whatever you're having done there. On the point of service, you do have the safety net of the out-of-network level of benefits. So there's an additional deductible and there's a 20% co-insurance that you would need to pay, but you would have coverage for that visit.
So what would the cost be total? 20%?
There's a cap of $2,250 for a single and $4,500 for a family. It is a separate deductible and co-insurance. So if you've been going in network and you've met your deductible, this is a brand new one. But it does give you or afford you the freedom to go wherever you want and still have coverage. Does that help? Okay. Other questions? Yeah.
UW-Madison, I thought I had seen somewhere in the HMO that there might be some gray area.
UW-Madison is a provider that we tend to send people to when we don't have providers in the area for coverage, but it does require a referral.
But you can still get that at the HMO.
Yep, you can get that. But remember, it's going to be for things that aren't, we don't have providers. Kidney transplants, burns, some pediatric things. Those are what we most commonly refer to in Madison. Is there a question back there?
If you are going to freighter, does that work the same?
Freighter is another one that we tend to refer to, but it does require referral. So it would have to be some service or a condition that there was someone in the area not qualified to treat.
And what if you've been getting treatment there or care there? And
We
your
still
doctor
need to
is
get that referral in place.
from you or from my primary physician?
It can be your primary care physician. It could be Freighter reaching out to us saying, hey, we need to continue to see this patient because, and they would need to send records and notes into us, and our medical director does review those cases.
So it's not cut and dry that it's...
No, it is not cut and dry. No, it's not cut and dry. So it does have to be for a very special reason.
So that would be an example of why you may choose the point of service. So you can choose to stay a freighter, but you're gonna pay that second deductible.
But when I called member services, I was told that all I needed was a referral from my primary care physician. And if he said it was okay, if he approved me going there, that
Arise does need to enter into that decision as well. So your primary care physician can request that for you, but we do have to approve it.
So do you approve it before I enroll, or?
No, that's the problem. Right now, what I would say to you is when we're done here, I'll take your name and phone number, etc. Once we get your information into the computer, which should be the second week of June, we can reach out to you from our case management, and we can start the process.
Okay.
Okay. Question?
Is there ever a point that you can switch from HMO up?
Thanks for that question. Yeah, there will be an open enrollment next year. So if you decide to go the point of service and you find throughout the year that we're approving the referrals that you were concerned about, next May, June, depending on when we hold the open enrollment, you could then change to the HMO. But you would be making this decision for 1 year. Okay? Other questions?
Is that with both ways?
Yep, you bet. Either way.
So the form in the back, the white form in the back.
Yep.
Is how I enrolled my daughter in close to Madison. How I signed a doctor for her in Madison.
Okay. I want to make sure your packet, okay, if you want to hold it up, it's that stapled packet. That's, I believe, where the enrollment form is. Where's Kathy? No, Kathy had a separate form. I'm sorry. There was a separate form. It says enrollment. I think that might be it. Okay. There on the bottom, I think you'll see, or is it on the flip side? Love audience participation. Thank you. Okay, so you're not going to find a doctor for your daughter, newest daughter in Madison. She is allowed, because of her location, to go to any doctor, and we will pay as if they are in network. Okay? You have to tell me, her name and that she's at UW-Madison, and we will then flag her file. Yeah. Right, but now when she comes home in the summer, she's got to go to an in-network provider. Yes. 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 Mm-hmm. Question?
What if a student in Madison stays there over the summer?
That's fine.
Okay.
Yeah, I'm just saying when she comes back to the area, even if she's visiting you for a couple of weeks,
Okay.
you need to go in network. Okay. Question?
Is there a process for rental of durable equipment?
DME, yeah, durable medical equipment. Kathy, help me. I have Kathy from our claims department back here. Is it $500? If it's going to be more than $500, we have to prior authorize, I believe.
That is correct. So you currently have it right now. How do we?
Are you renting it, or are you? Okay. You want to see me afterwards too, so I can get your name and number. Okay. Other questions?
I have one change I want to talk about. Go ahead, John.
Yep.
I was just saying, with the critical illness insurance, are we getting that from Arise, or are we keeping that?
That will continue with United Healthcare.
Okay, so if we were already enrolled in that,
No change.
it just is.
Yep, you're good.
Okay, so do we have to fill out the paperwork on
It's on the same form?
Yeah, it's all in the same form.
We just put
Just
in
check the
numbers and
box.
then it just is.
Correct.
Okay, does that involve, the proof of insurability if you will?
Nope, only for people that currently do not have critical illness and they now want to, there's no open enrollment for it, then they would have to give us evidence of insurability.
Well, then I have a question on the vision. Do you know if in the vision, are there any more doctors in the Sturgeon Bay area
That have been added?
that have been added to the vision?
I do not know, however, if you give me the doctor's name at the end, when I get back to the office, I can go onto their website and check to see if he's,
Where can you go on and find a vision doctor the same way they do?
Yeah.
And that's still through UHC.
yeah.
Yeah,
Yeah.
but I thought the nearest one was Algoma.
It is. As far as I know, no Sturgeon Bay doctor chose to join when they were reached out to.
Okay, so there may not be any change in that.
I have not. Has anybody heard of any doctors in town picking it up?
Just as a reminder though, your vision, you do have a vision exam coverage through Arise. And I think you'll find a few more providers there. It is once every calendar year. It doesn't cover any supplies, but you do have the exam.
Any other questions?
I just want to cover probably the biggest change here is retirees. We have two types of retirees. Ones that we continue, you qualify for the benefit, the district's paying a portion of your retirement. And then we had the confusing part, what we call direct bills. That means somebody their retirement benefit ended and they were still being on our insurance but paying for it 100%. That no longer is going to happen after December 31st, 2015. And then if you retire in a mid-year, you can go until December 31st of that year. That way you don't end up with two deductibles in a year. Before, it was always the trust just let people stay on insurance because you were teachers and you worked for a school district, you were allowed to stay on. We were always led to believe it never counted against our groups. Well, in reality that's part of our actuarial study. So our cost of our insurance is being driven up by people who no longer qualify or being paid by any of our districts. The consortium as a whole decided no longer can you do a direct bill pay. And so that is new and that will take effect. So if you're looking at retiring in the near future, you have to take that in consideration. Now, of course, today there's more options out there. You no longer have, what am I missing the term? Pre-existing conditions, and we have the marketplace. And many of our people who retired, and tonight's meeting is going to talk about options if you're on Medicare, how much there's cheaper options out there that provide just as good, if not better coverage, and that will be covered later. But I did want to mention that to the group because I know there's several people out here who are retiring or will be retiring in the future, and that's something you have to take into consideration. So no more direct bill pays. Question?
I do have a question about
Yeah.
it. I won't be getting insurance with this year, but what about COBRA?
Well, COBRA is that you qualify for. That's law.
All right.
COBRA, this doesn't change COBRA. COBRA is still law. We have to meet the COBRA laws.
And could I switch at that time from
I don't know a lot about COBRA.
Your COBRA period will start on your retirement date.
So COBRA starts on your
So
retirement
you
date.
only get 18 months, so
Right.
the
Yeah.
time will be the same.
Can I switch from family to individual at that time?
I'm sorry?
Could I switch from the family plan to an individual plan?
For
As
COBRA?
far as COBRA, but
Yeah.
do you mean, when do you mean, Mary?
Never, I'll
She can, yeah, Mary, you can work that out, but COBRA still counts. You still have the 18 months COBRA. That doesn't impact us, that's law. Any other questions on that?
But
Kathy?
I have a question for Anita about the vision you were explaining. Can you just go over that again and explain? I'm thinking it's probably going to be the same, that they're going to have to go online and make sure that the eye doctor is in the medical group, is that correct?
Yeah, so you will need to make sure that your your eye doctor is part of our network, and if they are, we do cover one routine vision exam and refraction annually, so but it's no supplies, it's not your glasses, it's not your contacts, but it does cover one exam every 12 months.
I think there are more Sturgeon Bay doctors.
Yes.
It wasn't UHC. There were doctors for that part of the medical coverage. Because we all had an email from a local doctor for that one.
Yeah.
It's the other eye that they just don't have.
The other thing is, now that Kathy raised her hand, I did promise to let you know that she wants these forms back by Friday. And I realize it's a really tight turnaround, However, in order for us to produce your ID cards and get them to you timely, she does need them back by Friday.
And I'll take the fall for that, because last time I said, let's go first and get this over with, and it was a disaster. This time I said, somebody else can be the guinea pigs. We will go after they polish the act. So that's why we're the last group in the consortium. So it's my fault why we're so late.
Do you need the authorization forms as well by Friday? That's one of those.
We have to send those directly to you, or can we hand it in with our enrollment? Send them directly to you.
You can hand them
Hand
in.
in with the enrollment?
You can, absolutely.
Along with the drug for 3 months?
Yes. That you can hand in with your enrollment, or you can fax it to us. I believe we've got our fax number on there with an attention. Kathy?
You touched on the Express Scripts, but what's the drug coverage if you just go to Walgreens or Walmart?
That's fine. Express Scripts just, they're the kind of the computer system, the hardware and software behind. But our pharmacies, we probably have 99% of the pharmacies in the United States with Express Scripts, so Walgreens, Target, Shopko, I know Bay Pharmacy is in, anything else? Walmart, yes, absolutely.
If you don't do, if you do a 3-month,
3-month has to be done through mail order.
that's what
You do get a discount of 2 copays being charged to you for a 3-month supply if your medication qualifies for that 90-day prescription. So, other questions? I think you guys all read our Q&A. You're not asking any questions.
On the form here where it says the UHC, if you have the critical illness, do you have to put down the employee amount and the spouse amount that you have for your family?
If you already have it right now, Cindy, just write enrolled if you want to stay the same.
Just enrolled?
Just
Okay.
enrolled, because that means you're going to keep what you have.
Okay.
Other questions? Well, we'll be here at the end. You can ask myself, Kathy, Donna.
Thank you.
Thank you very much for attending.
I know I'm Joe Studding, the soon-to-be former superintendent, but I appreciate you guys coming out. I want to just give a little bit of background why we're here tonight for a couple reasons. One is we're changing insurance companies again. Now, I was telling the teachers that in our last group, this is, for my 8 years, it's the 4th change for administrators and support staff every 2 years. So it's already now, it will be the 3rd change for teachers, so we're really falling into what the general public has been doing in the private sector, and that is bidding out insurance on a regular basis. The plan design that they're going to go over, I think, actually has some improvements, which makes it nicer. The big one for me was no primary care doctor if you're on Navigating, and so that's nice. It's still an HMO, and they'll cover that kind of stuff. But the second reason is the consortium, and we're a member of 9 districts, and we have been for years. We used to be not a consortium, just a group purchase. That was actually started by the trust, and we were always part of that, and a lot of things over time as part of that group just happened. The one thing that happened is when retirees, we have 2 types of retirees, and there's probably 2 different types sitting out here in front of me. One is the retirees that we still pay a portion of their insurance. The other one that it was unfamiliar in the letters to some people is the direct bill retirees. That's retirees who finished up all their benefits but chose to stay on. And the reason that happened was the trust always let that happen. As part of the consortium, they just said, well, we do that because we're for the public teachers, the public employees, and so it just happened. It never really was intended to be, it wasn't part of our benefit, it was just something that's being part of the trust, and supposedly never impacted us. Well, as we change insurance companies, we do find out that is part of the actuarial study, is people who we allow to stay on that really have no tie to us anymore, drives up the cost of our insurance. Obviously, the 9 districts take all that into consideration, and in 2015, December 31st, all direct bill paying will end. And then anybody who, when their benefits end, they will have the remainder of that year to match up with any type of, am I missing the word? Well, we want to go to 31st so that if they've already met their deductible, you match up with your deductible. Because if you change in July, then you're end up with 2 deductibles in 1 year. In that case, we didn't want that to happen. So that's why we've ended up where we're at. So tonight they're going to cover not only our change of insurance for those people, for everybody changing over and staying with us, but they're also going to cover the options that people have when you hit 65, and maybe options people ought to be thinking about even before December 31st of 2015. So I'm going to turn it over. We have tonight with us Arise and M3, and I'm going to let them introduce themselves.
Thanks, Joe. And welcome, everybody. My name is Donna Hirschlove, and I work for M3. M3 is the insurance agency that went to bid on your behalf. So we're the consultants for the consortium. And then I have here Anita, and she is from Arise. She's actually from the health insurance company that, and she'll address those health insurance benefits. One of the reasons that we're here is the increase that came through to the district from United Healthcare, the renewal, came to 25% increase. The districts couldn't pass that on to their employees. The districts couldn't sustain a 25% increase. So as part of our position at M3, we took it out to bid. And we found a very sustainable product, kept the benefits much the same, if not better, and Anita will go through that, with only a 0.3% increase. So that's really the reason that we're here. Now, this is our third retiree meeting that we've held, and so welcome. I appreciate you guys being here. There's been a lot of changes and a lot of decisions at the last minute with the retiree benefits, but everything seems to be finalized right now. I don't know, I'd like to see a show of hands, as Joe kind of talked about the district billed versus direct billed. So district billed are those retirees that are currently receiving benefits through the district, and then there's the direct bill. And the direct bill are getting their bills directly through United Healthcare today. Most of what we're going to talk about tonight is really directed towards those direct billed, because the those that are on the district bills are still considered like the active employees, and the benefits, there's not a lot of changes, okay? So are there members of the audience? Yes, Kathy?
Donna, there's a lot of people who are on the district bill here.
There is. All right.
Yeah, probably more.
Really? Okay. Yeah, because you guys could have came to the active one, because it would have been the same. But that's okay. That's why I'm asking the question. The benefits aren't going to be any different. It's just that I would like to let you know about some of the decisions that have been made district by district as far as the plans terminating, as Joe had mentioned. Where it's going to get confusing, and I hope they got the right packets, is if you're a district built, well, I guess it doesn't really matter, but every district has a different plan design. So if you're a district build and you came to your meeting at your district, we would have only focused on your plan. So hopefully just kind of bear with us as we get through this, because every single district has a different medical plan and a different dental plan and different combinations. So at the end of the presentation, we are going to be here for questions and answers. So if your questions aren't answered throughout the presentation, we certainly will meet with you one-on-one. So, district built. And like this says, the plans are going to differ by district, and the dates that their coverage, the direct bill coverage will end is going to be different. So I'm going to go through each district one by one. So in Algoma, for those of you that are direct,
No, we have a few mix. We have some mix. This was invited to the whole.
oh, I'm sorry, all my meetings have had a mix, so there's nobody here from any.
Yeah, we're mixed. Go ahead.
Okay.
They just remember. Go ahead.
Okay, I'm sorry. All right, anybody from Algoma? Okay, Algoma. Algoma, the direct billed retiree term date will be December 31st of 2014. And you should have all received a communication on this. I just want to reiterate that tonight. Okay? Denmark, their coverage is terming at the end of 2014 as well. December 31st, 2014. Denmark also has made a decision that any retiree direct billed, again this is not district billed, any direct billed retirees that are currently receiving dental benefits or that voluntary vision, that will end on June 30th of 2014. Gibraltar will be ending the direct billed retiree coverage December of 2015. Kiwani, December of 2015. The Kiwani will be terming the dental and any voluntary vision currently for any direct billed retirees as of June 30th, 2014. Luxembourg Casco, they will be terming the direct billed retirees December of 2014. They also are terming the dental and the vision on June 30th of 2014. Sevastopol is December of 2014. Southern Door, December of 2015. Sturgeon Bay is December of 2015. And Washington Island is December of 2015. You should have all received communications directly from your districts. Any question on those dates? Okay. All right. Yes, and as the slide states, changes in coverage will end either in 2014 or 2015 per the direction from the district. Okay? So, let's get into the benefit changes. The benefit changes, again, are going to differ by district. Not so much the medical plan itself or the dental plan, it's the deductible that's going to differ. Each one of you should have received a packet of information from your district, okay, and it'll show that which plan your district is offering to you. I would say that the majority of them all went with the exact same plan. There might have been a few differences. So if there's questions on that, just let us know. Okay? So, your medical plan will be changing from United Healthcare to Arise. And again, Anita is here from Arise, so she's going to go into a lot of detail on that. She's going to get into details on the network and how the plan works. And I think you guys will be, you are the very last meeting out of all the districts for the last month and a half, and we have had a very, very positive response from everybody. So I think you'll be pleasantly surprised. The network, just to mention a few, includes the Door County Memorial, St. Vincent St. Mary's, Bellin, Holy Family, Aurora, Theta Care, the Mayo Clinic in Rochester, Minnesota. However, the network does not include Mayo Clinics within the state of Wisconsin, and Anita will explain to you how that all works. Also does not include the Affinity system down in Appleton. And for those of you that do have a dental plan, and again that varies by districts, the dental plan will be changing from the United Healthcare dental plan over to Delta Dental. And I'll talk about that after Anita addresses the medical plan. Any questions at this point? Okay.
Okay, thank you, Donna. My name is Anita, and I am with Arise Health Plan. I'd like to, first of all, welcome you as new customers of Arise Health Plan. We're very excited to have you as new clients. And for those of you that don't recognize the name Arise Health Plan, we were started in 1997 as a provider-owned HMO. In 2005, we were purchased by WPS Health Insurance out of Madison, Wisconsin. We cover Northeast, North Central, and Southeast Wisconsin. We are located in De Pere, Wisconsin, so all of your claims, all of your customer service will be happening in De Pere, and we are a proud partner of the Green Bay Packers, so we'd like you to know that about us. Depending on your district, we have 4 different health insurance plans we have to talk about, and I can't speak specifically to each one because each of you have different choices, but what I do want to talk about is what is the difference between an HMO and a point of service. With the Arise HMO, In order to receive benefits, you must visit a provider that is in our directory. What's different from the current plan is you do not need to select a primary care physician. So we take away that requirement, and as long as you visit a provider, whether it be a specialist, a dermatologist, an ophthalmologist, your primary care physician, a psychologist, as long as they're in our directory, you do not need a referral. You have coverage. So big difference. Now, the point of service. What's the difference between the point of service and the HMO? On the HMO, you have to use a provider to have coverage that's in our network. If you would go to a provider that's not in our network on an HMO, we would not pay coverage. We would not pay for that visit. On a point of service, you do have the option of going to an out-of-network provider, and we would have coverage for that. It's the out-of-network level of benefits. You do pay an additional deductible and co-insurance for that out-of-network coverage, but you can make a determination to go somewhere where it's a provider that's not in our directory. Question on that? Now, the one exception to this rule is emergency care. Emergency care is covered regardless of where you are and what provider or what emergency room you go to visit. Okay? All right. So, you would have a choice of a $500 HMO or a $500 point of service, $1,000 HMO, or a $1,000 point of service. Now, you should, let's see. Okay, within the HMO and point of service program, your primary care office visit copays are the same across the board. You have a $10 office visit copay for primary care. Specialist care is a $25 copay. The emergency room copay does differ by plan. The $500 option plans have a $150 emergency room copay, and the $1,000 plans have a $100 emergency room copay. Now, what's going to be new on this plan is copays. You paid your copay every time you went to the doctor's office, or if you went to the ER or urgent care or your specialist, you just kept paying them. They didn't accumulate to anything. Under our plan, they will accumulate to a copay out of pocket, which you'll see as the medical copay out of pocket. So for a single person, once you've paid $500 in medical copays, your copays are done. Coverage would be at 100% for covered services. On a family, that is $1,000 out of pocket maximum. So I guess the good news is you have a cap on the number of copays or the dollar amount of copays that you will pay underneath our plan. Question on that? So you have your deductible and co-insurance out of pocket, which is the $500 and $1,000 or the $1,000, $2,000, depending on your plan. And then additionally, you have a separate cap on the number of copays you have to pay of $500 for a single and $1,000 for a family. Then on your prescription drug, you will also have a cap on the amount of copays you have to pay for your prescriptions. With our plan, you have 4 copay choices, and it comes about because on the generic, we give you the subcategory where we will charge a 0 copay. So some generics will be at 0, some will be at $10, your brand name will be at $25, and your non-formulary brand will be at a $50 copay. And I'm going to go through the packet and we'll talk, and I have lists for you of which drugs fall in which category. So any questions on this? Okay, for those of you that brought your blue folders with you, I'm going to go to those. And in your blue folder, on the left-hand side, it should start out with grids that are specific to your school district. So those give you a little bit more information on the plans available to you. But I'm going to start on the left-hand side, and the first thing I want to talk about is preventive services. And it looks a little bit like this. So preventative services are things that are covered at 100%. There's no office visit copay, there's no deductible, no co-insurance. These are things that came about because of the Affordable Care Act. Things like one is shingles vaccinations covered at 100%. 1-year routine physical is covered at 100%. Mammographies, colonoscopies, all of that is listed for you. And so we want you to be aware of what those services are and when you can get coverage for them. Then the second sheet of paper on that side, or right behind that, preventative services, you'll have a sheet with an E up in the right-hand corner. Left-hand corner, sorry. I got the right hand. And that stands for Express Scripts. Express Scripts is the company that manages our prescriptions for us. And the prescriptions that are listed in capital letters are your brand name prescriptions. The ones that are in a lowercase letter, those are the generics. And this sheet gives you the most commonly prescribed medications. So if you take a look on here and your medication is in lowercase, that would definitely be a generic. Okay? Now I don't want you to panic if you can't find your medication on this list, because we do cover more than what's on there. And so the next sheet in your packet says accessing your drug formulary online. So you can go online, you do not need to have your ID card, you can do this right now. And I've given you the web address as well as what buttons to click and what the screen's going to look like and what to do to go on to the next one. So you can go out and either download that formulary or search that formulary online. The next sheet I'm going to talk about is the Arise Health Plan Value Drug List. Now I had said to you your generic has 2 categories, a $0 or a $10 copay. This value drug list is your list of drugs that are covered at a $0 copay. So on the front of this list, I've listed the medications by the condition that they treat. On the back of the list, they're in alphabetical order, so you can look at them either way. Okay? All right, then there are 3 more sheets on that side. One says Arise Drug Pre-Authorization, and then it says Door Kiwani Cooperative is the second sheet. There are medications that are very expensive in nature, and we do require prior authorization. But we know that when you're switching insurance carriers, it can be hard to get that paperwork done. So I've given you a list of those medications that do require the prior authorization. If you could look at the list and your drug is on here, I've given you a form to fill out. And by putting your name on the form and the medication that you're taking, we will put a little check in your file that says for the next 3 months, you can fill that medication, no questions asked. So for July, August, and September, that 3-month time period gives you time to work with your physician to get the paperwork in so that we can get the prior authorization in place for you. But we want you to be able to get your medications while you're going through this transition. And, you know, speaking of that, your ID cards are scheduled to go out the 4th week of June, so you will have them prior to July 1st, which is your effective date. So I would say that last week of June, start watching the mailbox for cards from Arise Health Plan. You will have one ID card for medical and the same ID card for your prescription drugs. So you're going to have one card for both. The absolute last form on that left-hand side is mail order. Through mail order, you are able to get a 90-day supply of most medications. And if you do it through mail order, we do give you a break on your copays. You will pay 2 copays for a 3-month supply. So instead of the 3 copays, you only pay the 2. The only way to take advantage of that is through mail order. So you do need to go through mail order to get that 90-day supply. Any questions? Okay, I'm going to move over to the right-hand side of your packet. So on that side, the first thing you're going to see is a map of Wisconsin with a bunch of counties in blue. That represents where we have providers. And if you turn that over on the back side, you will see that we list by county the hospitals in the county and the major providers. So in Door County, it's Door County Memorial. It's North Shore Medical, Aurora Medical Group, and Baycare are primary clinics. Kewaunee County, you'll see Bellin Health, Luxembourg Medical Clinic, North Shore, Aurora, Baycare. Really good coverage in these areas. You know, after listening to me up here, probably the first thing you might want to do is go home and make sure that your doctor is in our network. I did put another sheet in here on how you can look at our directory before you get your ID card to verify if your physician is in network with us or your specialist is in network. So again, it's kind of a point and click, and here's how you get to the information. Then after that, I did put in, once you get your ID card, there's a shorter way to get to our directory, so I put a reference sheet in there for you. Now, let's talk about what happens if you're outside of the state of Wisconsin, or you have dependents living outside the state of Wisconsin. We do have a network in place called First Health. So even if you're on an HMO, if you are outside the state of Wisconsin traveling, you can access an in-network physician in Florida, in Montana, in Colorado, wherever you are in the continental U.S. Question?
You said traveling, what about, we actually have some retirees living out
Yeah, no, that's fine too. Traveling, living, going to school, whatever you're doing outside of the state of Wisconsin. So we do have a network in place for you. You can definitely access a provider through First Health, but remember, regardless of where you are, emergency is covered no matter what provider you visit. So this would be for things like if a retiree was living, we'll take Florida, and you wanted to doctor in Florida, then you would look for these First Health providers. But if you're out in Colorado and you think you might have strep throat, you can look in the directory for a provider and still be in network by visiting that provider as long as they accept First Health. Okay? Now, so we talked about Wisconsin on this side, we've got all those blue counties. We've talked about the entire continental U.S. I still have that strip of Wisconsin where we don't have providers. So for retirees or college students living in that portion of Wisconsin where we do not have providers, we will pay those claims at the in-network level of benefits. So what that means to you, if you live in Madison or Eau Claire or La Crosse, or you have kids that live there, whether they're going to school or that's where they happen to reside, we will pay those claims at the high or in-network level of benefits. Now, if you have kids that are living outside of the area, I do ask that on your enrollment form, there's a section where you can identify them. Because if you happen to live in network, I need to know that they live out of network. Once you identify them, we then flag their file, and those claims always pay at in-network level of benefits when they're not in our service area. Okay? Questions on that?
Over here.
Yep.
Yeah, for point of service, and if you're out of state, are you limited to First Health, or can you?
Okay. Point of service will give you two options. If you use the First Health provider, then it will pay at the in-network level of benefits. If you don't, or if you choose not to, you still have that out-of-network level of benefits. Okay, so point of service, it truly means where you have that point of service contact. Okay? Is there a question back there? Okay. All right, then there are other forms on that right-hand side. Are information on how to access your explanation of benefits online, how to order another ID card, how to change your address, how to contact member services. But the absolute last form back there is an authorization form. Okay. So if you call me and you want to talk to someone at a Rise Health Plan about your spouse's claim or your kid's claims, I can't talk to you. HIPAA privacy, it will not allow me to talk to you. But if I have an authorization form on file that says you have been given permission to talk to me about your spouse or your children's claims, I can do that. And it can also be a family member or a friend or whatever, just someone that I know you have given me permission to talk to. So that form is an authorization form, and what you do is on the front page under section number 1, if I were filling it out for my husband, I would say Joe Cresswell, and then I would check that he gives me permission. I would turn the form over, and in section number 4, I would write my name, and then at the bottom, he would sign that form. Now, we only put one form in your packets. I apologize, because if you want to be able to talk, if your husband wants to talk to me, or if you want to talk to me, I need a form filled out for both of you. So in other words, you've given permission to me to talk to your spouse, your significant other, your child, your friend about your health information.
Anita, I'll go copy these and put some on the table.
Thank
So if
you.
somebody wants to grab some extra.
Thank you, Kathy. Yeah, we're gonna have some extras out on the table for you at the end. Yep.
So the person that you want the information about, say your husband is in section 1, that's it.
Yep.
Then you check for the box and you put your name.
Correct.
And then you guys do it.
Correct. Yep. Question?
Can you put more than one name on for authorization?
You can. It's better if you have a separate form for each person. Okay? Good question. Donna's prompting me over here. I'm forgetting things. Just as a reminder, with United Healthcare, any deductible that you satisfied, or even if you've met your entire deductible, that dollar amount will be credited towards the deductible with the RISE health plan, so it does not start over. Deductibles run on a calendar year basis. Question?
With our direct billing, might automatically withdrawn from their bank account. Can you do the same?
The question is on direct bill from the insurance company, if it's being withdrawn from your checking, can I offer that service as well? I can. I'm going to guess though the first one will ask for a check from you, and then we can set it up going forward. Okay? I shouldn't say my guess, I know.
So the first one is due 1st of July, but we don't get our.
Yeah, you know what, the first bill will be delayed, I will say that. So there'll be, and we've got the, I guess the delinquency process turned off, so you're not going to be terminated or anything like that. You will have time to pay that bill.
And then we have to contact them so that they stop withdrawing automatically.
Ooh, that's a good question. You know what, I think that's one, yeah.
They know you're terming,
But what happens, you know what, I would,
we will check on that. We will definitely have that conversation with them.
yeah.
I've called already.
Yeah, what'd they say?
Because I have this dentist direct bill, and the gals told me that if the administrator is different, because whoever administrates United Healthcare does all kinds of other, dental and insurance too, then by about June 25th, I should send an email to say that it's been terminated, don't withdraw, and then
I would send it sooner.
excuse me?
Send that to the bank.
No, send it to
United Healthcare.
United Healthcare. Do you get some kind of you still get a bill every month, don't you? At least I do for dental, even though they take it out of my bank.
We just have the regular. I don't get a bill, I just get an email thanking me for that they received my payment.
I would say, just knowing how sometimes it takes a while to change banking arrangements, I would go sooner than that in the 15th. But, we do frequently ask questions, and I think we'll add that to the list. I don't know if you have access to that. You should through your district. I know they're posting them on their websites. Yeah. The general way it works is the bills are released on the 20th, and then they're pulled on the 1st for that month. But obviously, it's not going to work that way. So in July, you'll have 2 payments, but just because of the timing. Okay. So on July 20th, correct. On July 20th, we would send you, or we would get the email saying, hey, this is going to be due, we're going to pull this on the 1st. And if the 1st falls on a Sunday, it's the business day closest to it. Okay. Question, Kathy?
Anita, can you explain anything, a coverage on chiropractic and how that works under RISE?
Okay. Chiropractic is considered a specialist, so it would take the $25 copay. We allow you to see the chiropractor for a certain period of time. Generally, it's anywhere between 8 to 10 visits. And at that point, if there was going to be continued treatment, we would contact the chiropractor and say, okay, we want to see a treatment plan. Because what is covered is care that is improving your condition. If it's a maintenance type treatment, that is not covered. So we're looking to see that the treatment that the chiropractor is providing is improving your condition. Is that what okay, thanks, Kathy. Other questions? Otherwise, we're going to turn it over to Donna for dental, and we will be here afterwards if you want to ask us privately. Oh, Kathy's got one.
I was just going to say, you might want to there's probably a lot of people here who have no interest in dental, and let them take
Yeah, if you have no interest in dental, you are excused, or if you have no questions. Yeah, and Anita will be in the hallway if you do decide to leave.
Are you going to cover though anything about other options for?
Well, yes, actually, well, what we're going to do is,
Hang on a second. Wait a minute.
hang on a second.
Paul Trudeau, wait. Tell those people over there to wait.
Hang on. Okay.
Wait.
Wait?
Yeah.
All right, just one more announcement. Thank you for that. For those direct bill retirees that will be losing their coverage, especially the 2014, if your coverage will be ending in December 2014, as Joe indicated, that term date was thoughtfully thought through, again, because you want to make sure that if you had satisfied in your deductible, that it will go over to the next plan, and that starts January 1st. The other thing is we're going to hold informational meetings in August for those that are losing their coverage in 2014. Actually, anybody can attend it, but it's going to go through what your options are with Medicare. And it's information only. There will be no selling at these informational meetings. It's going to talk about Medicare, what you can expect from Medicare, and for those under the age of 65, it will talk about the Affordable Care Act. Okay, so there's more to come on that. And that'll be sometime in August because the Medicare open enrollment is October 15th until December 7th. And then the Affordable Care Act open enrollment starts on November 15th. Okay, so that's coming up. All right, so let's talk about dental. Just like the medical plan, the dental plan is changing. Thank you, guys. And it will be moving from United Healthcare to Delta Dental. Okay, and I know not every district offers dental to their retirees, and each district, of course, has a different plan. And I'll go through both of those plan designs, and those plan designs are not changing. Okay, Delta Dental is a local company as well, just like Arise. They're located in Stevens Point, Wisconsin. Excellent, excellent customer service. They also have guarantees on some of their billable items, such as the fillings are guaranteed for 24 months, sealants are guaranteed for 24 months, so they have those guarantees set in place. There is a network with Delta Dental. There's a Premier network as well as a PPO network, and then of course there's always out-of-network dentists as well. No matter where you seek your services, from either a Premier or a PPO or a non-participating dentist with Delta Dental, you will have the same benefits. Okay, so the benefits are not going to change. What could change is that the Premier and the PPO networks have negotiated fee schedule with Delta Dental, so their fees could be a little bit lower. Okay. And you'll see on one screen you can save as much as 25%. However, you will still have coverage at the same level of coverage with a non-participating provider. 90% of the Wisconsin dentists are in the Premier network and 40% are in their PPO network. You can see the providers, the dentists that are in the network, and you can look that up at deltadentalwi.com. Okay? All right, 2 different plans, and again, each district, and if you don't know what plan your district offers, let me know. I've got a list of them. There is a one plan that has a $25 individual deductible, $75 family, okay, with a maximum benefit of $1,300. So once you satisfy your deductible, then the plan kicks in, and all diagnostic and preventive services will be covered at 100%. Your basic restorative services are at 100%, and then those major services are covered at 80%. Orthodontic services, if you have a dependent who is under the age of 26, they also have a benefit. It's a 50% coverage to a $2,000 lifetime maximum. The second plan that's offered by districts has a 0 deductible, still has that same $1,300 annual maximum, and then all services after that are covered at 100%. Okay? Does anybody have a question on what their district offers? Yes. Gibraltar is offering the 0 deductible plan. At 100%. This is the, right here is the 0 deductible. Okay, with a $1,300 maximum benefit. Now, with the dental plan, just like the medical plan, your deductible and out-of-pocket costs are going to carry over from United Healthcare to Delta Dental. That's a positive with the medical because you want to get credit for any deductibles you've satisfied. It will occur with dental as well. So if you've already reached your $1,300 maximum by June 30th, you're done for the year. You don't get an extra $1,300 for the last 6 months of the year. However, if you do have children on orthodontics services, that $2,000 lifetime maximum will start over again. Okay? All right. That pretty much sums it up for the dental. Again, Anita talked about the medical. Yes.
For July 1st to July 1st.
Calendar year is January 1st until December 31st. And all of your plans run on a calendar year. That's why the deductibles and out-of-pocket costs are going to carry over. Yeah. Good question. I think Anita's out there answering like 100 questions. But thank you. I know this is confusing. This is a confusing time. Lots of changes with the districts, and I certainly appreciate all of your patience. If you do have specific questions that you want to direct to the districts, by all means, they're there to help answer any of those questions for you. Otherwise, yes?
What is the direct number to reach you if you have any questions?
Me?
Or are you not available?
I am available, but I obviously have to pull out my business card to let you know what my number is. It's at M3. I'm not a RISE, and I'm not Delta Dental. I'm just with the insurance agency. But hang on, and I will get you that number. Isn't that terrible? I don't know my own phone number. I've never called myself. In the meantime, are there other questions?
Yes. Are you going to be around to cover any of Medicare options questions tonight?
Tonight, I could try. We don't know everything about Medicare, but I certainly can, see what your questions are and answer what I can. Absolutely. Okay. Any other questions?
Will we be informed of when and where the August meetings are happening?
Yes, we'll get in touch with the districts and we'll reach out to all the direct bill retirees.
Yeah, the districts are planning on, on sending that information out the same way as we did this. For some reason, we thought some of that would be covered tonight, so I apologize for that.
Yeah, and because we have so many people that are retiring, or their coverage ends in 2015, so much can change between now and 2015.
Yeah.
It just,
But some of those people may elect to go before then, because it still may be a savings to them. And so we'll keep you posted, because the next meeting will be will be focused on that. What are your options? And some of you may choose to make that before, in our district anyway, before December 31st of 2015, because it might be a savings for you depending on where you're at. So.
Yeah, it may. You may find that, moving to a Medicare plan may be more reasonable for you. Okay. I do have the number for a RISE here, but I am still looking for my phone number. I really apologize for that. Come on. All right, what other questions do you have? Okay, let me then put this down and look for my